Right, ma'am.
Hello, I'm Dr. Shalini M A, consultant and fertility specialist at Oasis Fertility, Hebbal branch, Bangalore. Today, I'll be talking about all about IVF. So, what is IVF? IVF is in vitro fertilization. That means whatever the fertilization which is happening, that is egg and sperm meeting inside the tube, is happening outside. That means in the lab. So that is when we call it as a IVF. Previously, it was also commonly known as test tube baby also. So when I was a young person, when I heard something called test tube baby, I thought, a test tube baby is formed inside a tube, and that is how I imagined it. But definitely, it is not so. So commonly, how a natural conception occurs is when an egg meets a sperm, which happens in the tube, a fertilization takes place and it forms into an embryo. After that, it rolls down into the uterus and where the implantation occurs. Following which, we get to know a beta HCG. Through beta HCG, we get to know that it's a pregnancy is positive and pregnancy continues after that. But whereas in IVF, we need to remove the eggs which are already inside the abdomen, that is in the ovaries. We take it out into the lab. We inject one egg with one sperm, and which later turns into a embryo. What more do we need to know about IVF? Who needs IVF? So first and foremost, the first IVF baby, which was born in 1978, was Louis Brown, and she was born through IVF because her mother had issues with her tube. That means both her tubes were blocked, and due to which she had to be counseled for IVF, and through which first IVF baby was born. And now almost more than 5 million children are born through IVF up until now. So the first indication where when we plan for an IVF is that when the fallopian tubes are either blocked or damaged, which commonly occurs whenever individual is suffered from a infection, pelvic infection, where the tube is very much damaged, where it cannot pick up the egg or sometimes transfer back into the uterus. So due to which there's a fertilization or the implantation can be affected. So in such cases, we do IVF. And also IVF tube can be affected even in case of endometriosis, or if there's any previous surgery, abdominal surgery, due to which there's an adhesion. In these cases also, we see tubal blockage or being damaged, which can affect the fertility. And the second most common indication is male fertility. So when we come to male fertility, we know almost about one third of the causes can be by male alone. That means the female partner may not have any problems. It could be in ovulation or tubes, but as such, the male has a male parameters, that is sperm parameters, are abnormal. It could be in form of very low count or very low motility or very much abnormal morphology. I mean abnormal looking sperms of sort. So in such cases also we do IVF, and due to which there we can improve the chance of fertilization and further into embryo, and further it can enhance the live birth chances also in such individuals. And the third one is in case of endometriosis. Whenever we talk about endometriosis, that means there's a chronic inflammation which is happening inside the body. So initially it could be in a ovary or it could be in a tube. So when a tube is affected, definitely there's a higher chance that we may need to go for IVF. And whenever an ovary is affected or any other organ, that means even around the uterus, that is in the peritoneum, if it is affected also, chronic inflammation can lead to infertility, where we may need to use IVF. In such cases, actually the IVF chance compared to other indications in IVF with endometriosis, because there's a low quality eggs, and low number of eggs also can be seen in such an individual, which may lead to lower success rate also compared to other indications. And the fourth one is whenever there is a primary ovarian insufficiency, or when we say primary ovarian insufficiency means, okay, the number of eggs can be very low. So in such individuals, or they may have a very early onset of menopause, that means the eggs are depleted very fast, or they're not there at all. It could be because of many various causes. One could be environmental, one could be lifestyle, one could be even genetic, where there are no eggs at all. They're born with very less eggs, or they're depleted very fast. So in such individuals, we take the help of a donor who is much younger, that means less than 30 years of age, who could have who would have had a one child, who is healthy. In such individuals, we do take the donor egg, and we can help these couples have children through IVF. And the other one is whenever a individual, that means it could be a male or a female, uh, when they're having cancer, or when they're having some illnesses where we need to give gonad, that means which injections or medications which would harm the eggs, or it would harm the sperms. In such individuals also, where we preserve, whether it's sperm banking, or whether in case of eggs, that means oocyte retrieval, that is egg freezing is done in these individuals, uh, there are lesser chances of them conceiving naturally. So in such an individual also, we could help them out by with IVF. And last but not the least, the last one is oocyte preservation, which is commonly nowadays done whenever a woman wants to delay her pregnancy and to freeze her eggs at a younger age, which would give her better chances. In these individuals also, we can do IVF. And one of the indications where they can definitely try naturally, and if it's still not happening, that is when we go for the IVF. These are all the indications, or the couples who need, or an individual who needs an IVF. And at what age do we need IVF? There is no specific idea, or a particular age only person requires IVF. No, when a person, that means a woman who is more than 21 who wants to freeze her eggs, then definitely the such a woman, we can do IVF and do egg freezing. Or a woman who is around 35 or plus, or any age for that matter, if they are suffering from some form of infertility, which could be endometriosis, block tubage, or any other ones which I've already previously mentioned, they can take IVF. There's no contraindication, but according to the ART law, a person beyond 50 years cannot go for a IVF treatment or any other form of ART treatments. And coming to the next question, how do we prepare for IVF? So, in general, we do a general examination for the woman who's come to us, do a basic ultrasonography of her ovaries, her ovaries and uterus. Tubes are not something which are generally seen and scanned unless that is abnormal. And we do a day 2 day 3 ultrasonography to rule out cysts, and we generally do a baseline FSH, LH, AMH tests, and other general tests, that as CBC, their serology, viral markers, and other tests to make sure that she's okay to start a IVF, to take these injections or medications for the IVF. So once we do that, we generally, the women tend to take injections from almost about 10 to 12 days. Daily injections need to be taken, and almost every second or third day, a scan is being done to monitor the follicles, how the follicles are growing, what are the sizes. And once this is done, she needs to take a trigger injection to mature the oocytes, or the eggs which are there in our body. So once this is done, almost about 35 to 36 hours after, we do a procedure called egg pickup, which is done under short general anesthesia. So in these procedure, we take the use of the transvaginal ultrasonography, and with the help of a probe guide and with the help of a needle, we aspirate these eggs which are there inside the ovary, inside a follicle, and we extract them. So once these extra are extracted in the lab, we on the same day denudation is done, and each oocyte is being injected with one sperm, and these are kept inside the lab, and we see them after 2 days for the fertilization, and then after that we check how many embryos are being formed and how are the grades, and depending upon that we take a call. So once this egg pickup is being done, what are the complications which we generally do see whenever a IVF is happening is that minor side effects initially when the IVF is being taken is that there can be mood swings, there can be bloating sensation, minimal amount of gastritis can be seen in some individuals, and sometimes in case, especially in case of a PCOS where the woman's ovaries are getting much larger than their usual size, they may feel heaviness in the lower part of the body, especially in the last 4 to 5 days. And other complications which we may encounter in IVF is post egg pickup, there can be a minor chance of bleeding, which is usually controlled, and and other thing is OHS, that is hyperstimulation syndrome, which can be seen in OSS, in PCOS women. So in such women, we take very effective steps to prevent that from happening. And even when if it does happen, also in kinds of mild form, we take necessary steps to stop that and help the women get back to in their health. And the next thing I want to discuss about in IVF is that uh, can we choose a gender in IVF or not? Definitely not. According to the PCPNT, we definitely do not have the right to choose a gender, and we cannot also just by IVF. We just by looking at an egg or a sperm or an embryo, we definitely do not will know the sex about it. Only in cases when a genetic condition is there affecting a particular male or a female, that is when we need to go for a genetic testing, and that is when we need to do the selection of the embryo only after approval from the government. And the next thing is, can IVF affect a woman's health? Definitely not, uh, because the injections what were being given to the woman are not usually which stays for a longer time. It usually stays for a day or more, that's all, and after that it's been excreted from our body. And because of the injections, when we give these injections, there is a good amount of estrogen hormone which is being elevated. Again, those are temporary effects which usually will not last for long. And so definitely it is not something which affects, and there are various good number of studies which are being done, and they also have mentioned that it doesn't really affect a woman's health unless it's already been affected because of a prior conditions, like if their liver is affected or they have a heart condition where because of this there's a over stress which is happening to the woman's body. That is when usually in such a woman we usually take a very much necessary steps, if at all. And definitely there are no contraindications to IVF in a woman, but if at all there is one, it could be in a heart disease or some other condition which would affect their well-being. In such situation, yeah, we take the help. Yeah. And so there's one more question, yeah, which is asked. Yeah. And so one more question which is commonly asked are the babies healthy who are born through IVF? So there is definitely all the babies which are born through IVF are healthy in general, but if at all there is a abnormality or which are seen, it could be in general, whenever a woman conceives naturally at an age more than 35. uh, Similarly, a woman who conceives through IVF, whatever the chances they have, also the same chances the individual who conceives through IVF at a similar age have the same factors. That means age is a most important factor which would affect the general conditions of a health of the baby which is being born, which could be genetic, which could be because of the high blood sugar levels. These also affect the health of a baby. So in general, whatever the chances of a general population have, it's the same chance that, uh, abnormalities which are born through IVF is same as that. So I would definitely say it is very much safer, and healthy babies are born through IVF. And so I think this is what I wanted to let you know all about IVF. And if any further viewers have any questions, queries, kindly ask. So definitely, it's a very good question which is being asked. Are IVF injections painful? Definitely not. Whatever we are using, most of the injections which we are using in IVF are subcutaneous injections, which are given, which are very tiny needles, which have very tiny needles, and smaller in size. So definitely those will definitely not cause. And there are others which are given, that is IM injections, or also preparations which are given, that means which are given to the buttocks, to the muzzle. So those may be painful, but again, we can be those injections also which are in purified form, when we give, they are less painful. So definitely not. So when it comes to whose sperm is being used in IVF, for especially in a couple who are conceiving, a male factor is there, and if it's more than 5 million, definitely their own sperms are being used, even in cases of a patient who has no sperms at all, that is, they're azoospermic. So in such an individual also, we do test them and get to know more in detail about why there is no sperm. Like if it is because of just the hormonal imbalance which is happening in their body, we generally give them, and then get to know about the status of the sperms after a few months. Or in case of obstructive azoospermia, that means a duct is being blocked where, it is not being let out. So in such cases also, we do something called a TISA or a PISA procedures, where we extract the sperms directly from the testis or from the epididymis. These sperms are being used in the IVF of the in these individuals. So even in case of azoospermia, we can still use a husband sperm. But if a single parent wants to be a mother, it could be a unmarried woman, it could be a divorced, it could be a widowed woman. All these women, if at all they want to conceive, we can use a donor sperm in such an individual. Or in case of azoospermia, where we cannot get sperms at all by any means, in those individuals also we do use donor sperms. As I previously mentioned, IVF is definitely safe for the baby. Definitely, and it by means of a PGTA, or by means of other means of testing of pre-implantation genetic testing, can be done in these individuals for the embryos. So when this is being done to these embryos, and we go for the implantation or go for an embryo transfer, definitely it increases the chance of success, and definitely we can rule out all these abnormalities also. In general, IVF does not cause a harm to a baby, or it doesn't cause an unhealthy baby. They're all healthy. Thank you.